Houston Health Department. Welcome to the COVID-19 Talk with Local Health Authorities. I have Dr. David Persse, representing City of Houston, Dr. Umair Shah, representing Harris County. I want to give thanks to past President Kathy Finninger of the Houston Rotary Club, who really came up with this idea, and the Houston Rotary Club is the sponsor of this event. First, not a question, just good news. Congratulations to the Harris Health System, which includes Ben Taub and LBJ Hospital, ranked #1 nationwide for its commitment to equity, inclusion, and community health, according to Massachusetts think tank.
Oh,
that's good news.
I saw that on LinkedIn, and I said congratulations as well. So, congratulations.
I think that's especially strategic and critical now, given what we're going through.
That's right.
A lot of questions regarding schools. I have to decide this week whether to send my child to school in person and need guidance. If someone is sent home ill in his class with possible symptoms of the virus, does every child need to stay home for days until the test results come in?
Well, let me
go ahead.
just start with the global, and then David, you can answer this. But the global is that there have been a lot of moving pieces right now related to this. We previously had the state, through the Texas Education Agency, give guidance on how schools would be reopening, and it sounds like just yesterday there was an additional information from the governor that there was going to be new guidance coming out from TEA that allowed for schools to start virtually for some period of time, as long as the local health authority had some say in that they should not be in person. We're waiting for that official order so we can see the details of it. We're obviously very concerned ourselves as parents, grandparents, and certainly community members about our kids and our faculty at the schools. So we don't have all that worked out because we're still working to see what obviously TEA and the information and what the allowances are. But I think it dovetails then into the specific question about how can parents and teachers and everyone assure that there's safety within the school regardless of when it goes in person. So David, maybe that's one from your end.
So thanks, Dr. Shah.
But before you comment, the next question is related to that. Okay, TEA says the local health authority, that would be y'all, DSHS and the governor have authority to close schools for health issues. Who specifically can make this decision for Houston and Harris County? Y'all are health authorities.
Yeah. Well, I think it goes back to your initial comments. We're waiting to get the actual order to find out exactly how it's written, to find out, does the school have to ask us? Do we just tell the school what, how's that done? So we don't know exactly how that works yet. But getting back to the point, the first question about, if my kid goes to school and one of the other children or my child tests positive, somebody tests positive. So I want to get people to start thinking about it. It's not a question of eliminating the risk. We're way past that, right? It's managing the risk. So to answer that question, it's going to depend on a lot of specifics about that school setting. Most particularly, what is the density of students in the room? So if you've got a classroom where you've got a standard size classroom and there's 5 students in there and they're spaced out and one of them becomes sick, probably the other 4 don't need to worry about it. You got, now what's the magic number? Is it 10 students in that room? Is it 15 students in that room? At what point do you cross the threshold? And I don't know that we know yet. But, and then the other thing is that is really unpopular in my mind right now is this whole issue of aerosol or airborne spread. Because of that, we're waiting to see what the CDC does with that after the WHO changes its position. But if the CDC comes out with new guidance, that could be a game changer with this whole school situation.
Absolutely. The LA superintendent talked about preventing schools from becoming a petri dish. Many guidelines are vague and contradictory. I am overwhelmed and don't know who to believe. What is the age cutoff for a child to wear a mask all day?
Yeah, so I'll give you my 2 cents. We've seen ages vary. We've seen 10-year-olds, someplace saw, under 3 didn't need to wear a mask. And the reality is kids don't all mature at the same rate. And it kind of goes to, for my kids, my kids are all grown now, but for my kids, if the kid will tolerate wearing the mask, then they should wear the mask. If the kid just won't tolerate and rips it off, what are you going to do, right? But the more people we get wearing masks, because let's face it, kids so far do not appear to get as sick when infected. We don't have any reason to believe they don't become infected, but we see this every cold and flu season. It's kids unfortunately are great spreaders of viruses. And so this virus we can anticipate will be no different. Remember, we haven't had kids in school while the virus is spreading like crazy in the community yet. So we really don't know what impact having kids in school will how much that's going to feed the spread of the virus. But we just don't know yet.
Right, and I think that's the thing I would pick up on is just the fact that, you know, now it does appear that there is a look across the state and saying, look at what's happening in your local or regional context and what's happening in those communities,
Right.
and hopefully that can guide what's going to be happening. But we do want to reassure our parents as well and our teachers that we're definitely hearing you, and this is not something where we're just saying we don't know, or we just are waiting for additional information before we can actually give really good guidance, and right now we don't have that.
Speaking of teachers, I love teaching and my students, but I'm afraid. Can you recommend what I can wear to protect myself while teaching all day?
Yeah. Well, I think that the one thing, you know, the recommendation, I'm going to be honest with this question, but the recommendation is that we reserve the N95 mask for people who work in hospitals. But if you are a teacher who has underlying illnesses and is over the age of, you know, 50, let's say, and you're worried, probably the best thing that you could do would be to get an N95 mask. Now, today, our official recommendation is that they be reserved for the healthcare workers, but at the same time, we know that the production of those is ramping up. So I would think that probably the next layer, the next level of, next slice of society that the CDC, et cetera, would recommend, maybe teachers who are over the age of 50 or those with underlying illnesses. I don't know, you may feel differently.
Yeah, no, I mean, I think this has all been about the availability and the supply chain pieces that continues to be a problem in this country related to this pandemic. And so, I do agree that, if you are at higher risk and you still need to go out because of your profession or some other reason, then a higher level of protection is what's necessary.
Our school plans to have all children remain in the classroom even to eat lunch. I know they will not be wearing masks, at least at that time. Should I refrain from eating with them?
Yeah.
Real questions here.
Yeah.
I missed
Real
the beginning.
concerns.
Was that from a parent or was it a teacher?
This is a teacher.
That was a teacher. Okay.
Yeah. Yeah, it's a tough question. I don't know.
Yeah, I don't know if I got the full gist, but if if we're saying that you don't have your mask on while kids are eating, should I be?
The kids are not going to be
Right.
masked while they're eating.
Right.
This person is asking, should I eat with them?
Yeah.
Which means that no one in that room will be masked if they're all eating at the same time.
Right, and I think that's where you have to really take some common sense precautions. And to David, your earlier point, somebody who's older who has some additional underlying conditions may want to refrain from having their mask off at that time, versus others that could look at it differently.
And potentially for some time after lunch.
That's right.
So maybe the teacher needs to eat first.
Yeah, right, yeah.
So you did come up with something specific.
There you go.
Okay, you have been joining us for the COVID-19 talk with local health authorities. We'll be right back.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you're singing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
Welcome back to COVID-19 Talk with local health authorities. One last question for schools for now. With virtual education not working for many, loss of social emotional skills, no free meals, and inability of parents to go to work, where's the trade-off in your minds between opening up schools or keeping them online? I know you're conflicted, David.
Yeah. And I've been saying this for quite some time, is that, kids need that social interaction. They need, we also know there are some kids who get meals at school. That's one of their own places. So kids need to be in school. And so it's again, it's not eliminating risk, it's managing the risk. It's a risk-benefit balance that's got to be struck. And but the answer is, we got about 6 weeks to get it so that these questions are much easier to answer. I really, if anybody wants to get anything out of this, it's wear the freaking masks and don't have large gatherings and quit arguing about this like it's a political thing. It's a biologic thing. We got 6 weeks to get our act together before these questions become the front page news.
No, and I agree with you, because this would be a different narrative if we were where we were a couple of months ago and having this discussion. It's like, yeah, well, of course we want to, the trade-off of going to school is going to in person make sense because the transmission is so low in the community, but we have increased transmission, increased cases, increased hospitalization, all the numbers going in the wrong direction. Why at that time would we be looking at this in any other way but to say that the health and the safety of children and faculty is absolutely of concern if you go in person. So that's why we're in this conundrum, and that's why you're right. Wear the mask, stay home. If you don't need to go out, stay home. And also obviously all the social distancing and avoiding gatherings and washing your hands and getting tested. I mean, this is all a part of this system of how do we fight this pandemic.
And let me say one thing. As soon as it starts getting a little bit better, that does not mean it's game over.
That's right.
That's probably the thing that's frustrating me the most right now is people are starting to look at someone else and say, oh, see, they're getting better. So? It means nothing. Nothing.
Right. That's right.
I was in a room with several people 6 feet apart at a meeting, and one of the participants' family member tested positive. Should we all self-quarantine, and for how long?
So no, that would be, so there's the known case is the person at home. Their contact would be their family member. They should quarantine, but contacts of contacts don't need a quarantine.
Right.
Yeah, unless they were saying that individual was tested positive for some reason, then it's different, but absolutely.
But then they become
it's the contact of a contact they're referring to. A UK study suggested the immunity from the virus is short, with the antibody response peaking around 3 weeks and then declining as quickly as 2 to 3 months. If true, there will never be a herd immunity. What does our future foreshadow? Do you know of other research on this most important topic that either confirms or rejects the preliminary finding? There was a discussion on the call with Dr. Fauci this weekend where he talked about that.
Yeah, this is, I think this is what, continuing to have evolving science that will continue to evolve. So what we say right now to the viewers will change undoubtedly by the time next week we come back. So we're trying to stay up with the evolving science. But the issue is that if it is true, then it's confirmed and it's consistent that this is the case, then it does make us very concerned about a couple things, both vaccine as well as immunity from a standpoint of a herd immunity concept. That's what concerns us. This is a super slick virus. You say it all the time, breaking all the rules. Super slick virus, and we've got very few tools to fight it. That's why we got to just, it's not sexy to wear a face covering or say stay away from each other.
Well, speak for yourself.
That's all we've got to
Speaking
fight
of being
this.
super slick, speaking of being super slick, just read where South Korea has just said that more than 60 people tested positive again after recovering. In China, 5 to 10% of people tested positive after recovering. but that no one knows if there were special circumstances contributing to either outcome. Your thoughts?
Well, this is one of the things we discussed with Dr. Fauci, and we saw on the Eisenhower that there were a number of sailors who were sick and positive once, and then they became sick and positive again. So it is apparent at this point to me that immunity may be short-lived for some people. We don't know. Maybe for all, but maybe at least for some people, and that you can get reinfected. The question that I tried to pose to Dr. Fauci was, when you get infected the second time, are you as likely to become just as sick as anybody else, or will you get less sick? And he sort of answered, well, if you have some residual immunity, then you would get less sick. But the question is, do you get less immunity, or do you go to no immunity, at which point you would then be as likely to get just as sick as anybody else? And I don't think we know that yet. He didn't seem to have that answer.
No. We have a Facebook question. If masks are effective, why can't people be with their loved ones in the hospital?
Well, we believe that masks are effective, but that doesn't mean they're 100% effective. And so if you're with your loved one in the hospital who is a known case, you're asking to get infected.
These are increased protections, right? It gives you increased probability of protection, but if you have increased probability of risk, now you start to play the game of one's going to win out, and that's why we say in the healthcare setting that let's limit visitors, because we are concerned about potential for transmission.
You know, the 95 and N95 means it blocks 95% of the particles. 5% still get through.
That's right.
Last I saw, the increase in cases in Houston region may or not include jails. Can you explain?
Well, I'll tell you, we've worked, the three of us in our organization worked really hard with the Harris County Jail to try and keep some control over the jail. Remember, the jail is a small place with a lot of people for all the time. And so it's a perfect place for viral spread. We worked really, really hard. And I really need to, give a shout out to the folks at the jail for all the work that they have done. Right. For the medical staff and the jailers, they've done a really good job. We've got, there is still virus in the jail, but it is not what we had feared.
That's right. And to the sheriff, Sheriff Gonzalez as well, for his leadership in this. And I think this has been, and it's also a transient population, and there are so many different unknowns, and then evolving science has also made it challenging.
Okay, Orlando's VA Medical Center said that the positivity rate is 6%, not 76. Or Orlando Health, 9.4, not 98. It previously reported. Are we making errors like this?
Not exactly
sure about
here.
Yeah.
So we've been saying that it's been 1 in 10 or 1 in 8 tests in the community that are coming back positive previously, and now it's 1 in 4, 1 in 5, depending on what, 20 to 25%. That just means that we've increased the number of the actual tests that are coming back positive. Can't speak to other communities, but that's what we're seeing here in Harris County.
Yeah, we're seeing the same thing. So the city of Houston, we're already at that 25% range as well. And we're seeing that across the state that the numbers that went up and they went down, and now the percentage come back up. I think this morning it was at 16.9, almost 17% for the state. So
that's right.
Okay, the WHO has reported that 20% of those infected with COVID-19 progress to severe disease, including pneumonia and respiratory failure. That's a 1 in 5 chance of life-threatening complications. Does that sound how?
Does that sound right?
1 minute.
Yeah.
Well, we do say that 80% of, this is previously 80% would have mild or no symptoms, and so 20% would have more significant ones.
That's right. That's right. So that's consistent, yes.
Okay, how can I become a contact tracer?
Well, we have a lot of our slots filled at Harris County and City of Houston, but if you're interested and we have the ability, and I'm sure there'll be some turnover over time, to contact our health departments.
Okay, contact your health departments if you want to be a contact tracer. This is the COVID-19 Talk with Local Health Authorities. We'll be right back.
With coronavirus spreading, people at higher risk must take extra precautions. You are at higher risk if you're over 65 or if you have an underlying medical condition like heart disease, chronic lung disease, diabetes, or if your immune system is compromised for any reason. If you're at higher risk, stay 6 feet or 2 arm lengths away from others. Better yet, stay home if you can. The choices you make are critical. Please visit coronavirus.gov for more information.
Learn to cough and sneeze with your pal Grover. Step 1. Realize you're about to sneeze. Step 2. Move your elbow toward your nose and mouth. Step 3. Gesundheit. 1, 2, 3. Remember to cough and sneeze into your arm or elbow and not your hands.
Welcome back to the COVID-19 talk with local health authorities, sponsored by the Rotary Club of Houston. It sounds like positive news about the newest vaccine from the National Institute of Health and Moderna, which is connected with Dr. Fauci. This is a 2-shot vaccine. Does that mean the expectation is lifetime protection?
I don't know.
Yeah, I don't think so.
No, probably not.
I think that's what they're trying to find out.
Yeah.
Too early to tell.
Can you recommend a video that our staff can watch before returning to the office in person?
Nothing comes immediately to mind, but I would suspect the CDC probably has something, but nothing immediately comes to mind.
What I would just recommend is going to our respective websites, Harris County Public Health, Houston Health Department, also looking at the state Department of State Health Services and/or CDC, and there are a lot of videos we have, but I'm sure one of those could help. Yeah.
Another one just came in from Facebook. Please help. My mom needs knee surgery as she torn 2 ligaments in her knee. But with the elective surgeries, COVID cases rising, not have insurance, she can't get help.
Yeah.
Actually, I'll ask this person to contact the health department. We do have a unit that is responsible for connecting people to health care, and so we'll see what we can do with that.
I think in general, the only thing I would say, Stephen, is that it's really an individual decision back to the healthcare provider, the doctor, and the patient to make a determination of how urgent the issue is. We can't tell just by a text or a Facebook of how urgent that issue is, how elective is it or how urgent it is. And that's something it has to be on an individual basis.
I think the issue there is related to insurance and being able to cover that. So we have an access unit that will actually make that assessment and try to help as much as possible. If I donate blood or plasma, will I be told whether I have antibodies?
Yes, actually. I just learned that myself yesterday when I donated blood.
You did?
No, it takes about a week before you get the answer.
Okay. I'm donating on the 22nd.
There you go.
But I do platelets and all of it at the same time. Hopefully it won't take me 80 minutes next time. LA Times on July the 10th had a story about giving antibody-rich plasma of COVID-19 survivors to high-risk healthcare workers via injection. Federal officials have rejected the proposal. Dr. Fauci said using convalescent plasma was an attractive concept, since it's already being received by 28,000 patients and was given even during the 1918 flu epidemic. Why are we delaying?
Well, we are giving convalescent plasma currently here in Houston to people who are seriously ill in the intensive care units. I've not heard of giving it almost prophylactically to healthcare workers. I've not heard of that, have you?
No, I haven't either, yeah. I mean, I think the one thing I would say is that this is actually what has been the good part about this response is that because we were able to flatten this curve for so many months, it actually allowed our healthcare system some time to learn from other therapies, including remdesivir, the antiviral, and the now IV Decadron, the IV steroids, plus plasma therapy, and having the position a patient on their stomach and not going straight to a ventilator. All these strategies have been incredibly employed by our healthcare partners. We have to give them so much credit for learning, but we also have to give the community credit for actually allowing some of that time to do that.
Right.
Yeah.
Okay. Mayor Turner has asked about a 2-week shutdown of the state. How will this flatten the curve? Is 2 weeks enough? And if the governor does not approve, can local health officials issue any kind of ruling?
So I'll take that. So if Look, we got about, it's all about, at this point, it's about two issues. One is the hospitals are pretty darn full, and they are doing some really creative stuff to continue to make capacity, but they are stressed, right? They're not overwhelmed at this point, but we can get there. And then we got the school syndrome. If we're going to do something, we need to do it now, right? There's a lag between when you do an intervention and things improve. And so we're painted already into a corner. We got a little bit of room, but not much. So if we want to not get our backs completely against the wall, we need to do something now. So that's what the mayor's getting at, is that we're running out of time.
Okay. UC researchers, or U of H researchers, are involved with creating a nickel foam air filter that can effectively catch and kill the virus. In preparation in case anyone in my home is sick, would special air filters help?
Well, I first read about this last night, so I don't...
I didn't read much about it. I would just say that, I mean, we do know that, now when you said about airborne transmission, I mean, the real concern is, and we're going to try to get some additional expertise on this, is that it really does appear that there may be some ways to look at ventilation and how things are managed throughout an HVAC system, but also trying to find what that looks like on an individual basis. But I don't know about the specific filter.
Okay, and I would say we have 2 minutes left. The next question is related to airflow too. What are your thoughts about how office workers will fare when they return to their office? What do you need to do before clearing those workers to return to work?
One is to wear masks, but David, what
it's the same thing. Wear masks. People need to be 6 feet apart. Don't come to work if you're sick. If you did get sick, you got to wait for 30 days, no fever, 10 days since the first. I mean, none of those rules change. If you follow those rules, you should be okay.
Yeah, and if you're the employer, make sure you try to help your employees.
Getting to the rest of the questions, Army medical task forces in town appears to be creating emergency hospitals. Other cities have asked, what do we need, and does this show we're having problems covering our hospitals?
Well, I just said that the hospitals are pretty stressed.
Yeah.
And so they're coming in, the military is coming in. What they've set up so far is pretty small. There may be more stuff coming, but yeah, we're stressed.
What are medical resorts?
The medical resort is a nursing home that has been basically vacated, that the state, for the most part, has been state personnel coming in, and they are taking patients who are getting better in hospitals. They're not quite ready to go home, but they can go to the medical resort, open up the bed in the hospital, and then that person finishes whatever they need, and then they actually go home.
Yeah, one of the issues that we're seeing in the hospitals is around staff, not just the beds.
Here's a question I didn't get to last week. Basically, it's saying that his neighbor wouldn't let an exterminator come into his home, even though his house is overrun with roaches. Isn't this reaction overkill?
Well, you know, we actually had an exterminator in our home just a few days ago. He had a mask on. He was doing all the things to stay away from other family members, et cetera, when he was doing his work. So I think that you have to really, again, balance the risk.
Yeah. How accurate is virtual medicine that has become so popular because of distancing?
Well, it depends on what it's for, right? For dermatology and skin, it's pretty good, but you know, I mean, it's not as good for cardiac and cardiology when you're trying to figure out what's going on in the heart. So it just depends on what the activity is.
With 20/20 vision hindsight, what should we have done earlier in less than a minute?
We should have opened up much more slowly.
Much more slowly, and we should have actually made sure that people recognize that you needed to take precautions and preventive measures while you reopen.
Right. You have joined us for our COVID-19 talks with local health authorities, sponsored by the Rotary Club of Houston, with Dr. David Persse representing the City of Houston, Dr. Umair Shah representing Harris County. Thank you to past President Kathy Finninger, who helps us with these questions, of the Rotary Club of Houston. I am Stephen Williams, Director of the Houston Health Department. See you next week.
Talk about